Today, we go beyond with Polina Mamoshina, Chief Scientist and Chief Operating Officer at Deep Longevity, to have a fascinating conversation about aging clocks, biomarkers, the aging process, artificial intelligence, and much more. Let's go beyond with Polina Mamoshina.
Go beyond your horizons.
Here we are today with Polina Mamoshina, who is Chief Scientist and Chief Operating Officer at Deep Longevity. Polina, thank you so much for connecting to the spacecraft today.
Hi, thanks for having me. It's my pleasure to be here.
Thank you. Well, I'm very excited because this conversation is going to link a little bit with the one we had with Aubrey de Grey. But today we're going to focus more on some practical aspects regarding the combination of artificial intelligence, deep learning, with topics as fascinating as aging clocks, biomarkers, this wonderful work that Polina is doing at Deep Longevity. So I want to begin, Polina, with the vision, the mission, the motivations behind your work. And in one of your interviews, I watched as you were talking about one of your motivations, that is your father, that is a pilot. And you were talking about when you look at your father that obviously with age is getting more fragile, and I completely resonate with this when I look at my own parents, and I think a lot of the audience when they look at their older relatives and we see them getting more fragile. So to begin with, could you talk to us and to the audience a little bit about the motivations behind your work? What is the drive behind working on combining technology with the aging science?
Right. Yeah. So, well, my father is probably like the whole reason why I got involved with science in the first place in the beginning. Mm-hmm. So yeah, I mean, he's 65 right now, and he retired, like, let's say, quite recently. So he was working for more than 40 years as a pilot, which is, you can imagine, is a really stressful job. He was constantly changing time zones, climates, all of that. That's just really, really stressful, especially thinking also about like radiation out there in the sky. So all of that, of course, contributed that. And I was in university and seeing him actually, getting so tired with his work, but also seeing him aging. So obviously by his, let's say, visual science, it's actually was like a bit stressful for me. And that's what motivated me to enter the field of genetics and bioinformatics, and later of aging research.
Very interesting. This is, I think, is a motivation that resonates with everybody, with almost everybody. And then the mission of your work and of Deep Longevity, you speak about providing people with the most efficient aging and longevity clocks. So let's begin for our audience and for myself. Could you tell us what is an aging clock?
Great. So aging clock is a sort of like a specific marker or indicator of aging that can show the biological age as a number of individual. And biological age is something that reflects physiology. So we have our chronological age that we kind of, count from our date of birth, and they're usually specified in our passports and etc. in other documents. Yet they're usually not a representative of what's happening with inside of us, with our biology and etc. So we need some tools that will actually can help us to track aging process and later also track interventions or different lifestyles. So whether those are accelerating or decelerating aging. So whether they're making us age faster, or there are interventions that can reverse aging in some way, or at least slow it down. So for all those measurements, we need aging clocks. So there are kind of indicators that we can use in clinical trials in everyday life. And this is what it is, the aging clock.
Very, very interesting. These indicators. Yeah, I think I also heard you saying in an interview that we don't want to wait until people die in order to understand the impact of different changes, etc. And that's why you also speak about biomarkers, right? I mean, what is a biomarker, and what is the connection between the aging clock and the biomarker?
Right. So aging clock is a sort of biomarker. So biomarker is, again, it's some characteristic that kind of reflects pathology, well-being of our body. And aging clock is a kind of a specific sort of biomarker.
Okay.
And we need them because in longevity research, there are a lot of challenges. And one of those is that how can we actually prove that interventions will work? Mm-hmm. Of course, we can do a lot of experiments on animals, but then they're limited in their translation rate into human practice. So most of the things that work on animals actually fail to show efficacy in humans. I'm talking about also other therapeutic areas. So, for example, for oncology, for cancer drugs, it's 86% of drugs that have been shown efficacy in mice models. They're not working.
Wow, 86% that work on mice, but don't work on humans.
Right, exactly, yeah.
Wow.
Yeah, so the failure rate is quite high. Of course, it depends on the therapeutic area, but we shouldn't expect this to be that much lower in aging space. Because again, we as a species, we're already kind of a long-living species. So let's say evolutionarily, we already designed to live longer. Yeah. And it means that those short-living species, like mice, they're probably interventions that will work on them doesn't mean that they will work on us. Because of that again. Because of those differences, let's say, they're not designed to live long. We are designed, and therefore, also, we of course we can replace them with long-living species. We can replace them with naked mole rat and others that live longer, but then it will actually will be in another issue that we will have again with experimenting with humans, and it's also like related to the point that you mentioned before, that in the end we want to prove the efficacy in a rather short time frame. So let's say clinically relevant or visible time frame. Even a 5 year of such research, when we investigate the efficacy, will be just too long. It will be really expensive. It will be really hard to include participants who will really want to participate in a 5 year study to see an effects. And therefore, it's just usually not visible. There is a study like that, like TAME study. You probably have heard of it, by Nir Barzilai on Metformin. Yes, there they kind of follow up people for 5 years to see how Metformin will impact mortality, and also all-cause mortality, and also specific mortalities related to cardiovascular disease and other diseases. But it's not visible to do this for every single drug. Yeah. The TAME was so expensive. It was really hard to raise money for it. So Professor Nir Barzilai, he did an amazing job to do that. But it's not going to be like that for other drugs. So we have to do something that will be measured, let's say, within a year. And biomarkers are those tools that can actually, show us the effect within a year, or at least we believe that they will show that. So meaning that we don't have to actually wait for people, let's say, to die. I know it's a bit cynical, but then you have to wait for people to die to see in which groups there are some differences between treated and untreated people, right? But with markers, because we know that they are predictive for mortality themselves, we kind of can use them as a surrogate indicators. So without running those lengthy studies, when we have to follow up people for a long time, we can actually, measure their biological age within a year and see whether the biological age responded to the therapy and they got younger by their biological age, assuming that because biological age is predicted for mortality, and like people who are predicted older biologically than chronologically they will have shorter lifespan and other way around. So if we measure this, we will see if they got younger biologically, we would expect them to live longer.
Yeah, this is totally fascinating. And this makes me really wonder about two things that I was going to ask you later on, but I'm going to bring them forward. One of them is, so we want to, as quickly as possible, understand, how that those biomarkers are changing that denote our real aging compared to the official number. Now, because I also saw you have something called Young.ai, that is kind of like an app that you can use to monitor. And I had a guest in the podcast, Bila Bandari, a good friend of mine that works on wearables, wearable technology. So also that can go inside the body. So what I'm wondering is, do you think, is it the final objective that we could almost monitor in real time? How is that divergence happening between our theoretical age and our real biological age? Do you think that is a realistic objective for the future, that we can almost in real time monitor that divergence?
Right. Yeah. It should be realistic, but I can imagine it would be rather annoying because you would expect those things to change quite quickly, right?
Okay.
You can, eat an apple or decided not to smoke today, and then you would expect those measures to kind of reflect those.
So it would change. It's very, very wild. Yeah.
Yeah, exactly. At least, you probably will be able to see some trends, but maybe it will be, let's say, it's not going to guide you in some way if it's going to change that much.
Okay, so it's not worth. So it is enough to basically get this information on maybe on a monthly basis or something like that.
No, tracking, it will be important to do this on a daily basis.
Yes.
Because, having variables that track your sleep data, tracking your heart rate or like your physical activity, they are just, this data is amazing. Yes. You should collect those. And it only means that you shouldn't actually probably return predictions on a daily basis, but of course you can, in terms of biological age predictions. Mm-hmm. But then you still need this data coming to you daily, and then you will just, return predictions after a month or so.
Yeah. Makes sense. And so now this kind of monitoring that, for example, you guys do with this Young.ai app, so the sensors that you need to monitor and get the data that you need, is it enough with the sensor that a mobile phone has, or do you are you planning? Will you need any other type of monitoring or sensing hardware?
Right. So Young.ai is an app that can work with as simple data types as questionnaires. So you just you have to fill a survey, and it still will be able to return you some predictions. Of course, they are less accurate compared to your blood test or data coming from wearable devices, but it's still something you can work with. In terms of devices we support right now, we work with both Fitbit and Apple Health. And with Apple Health, you can collect your data from your phone directly. So let's say number of steps that it's recorded automatically to Apple Health. And then can be passed to Young.ai. But also you can sync your Apple Watch or Oura Ring, everything that syncs with the Apple Health, then can be fed to Young.ai.
Okay, perfect. So you work with these third-party devices, Fitbit, Apple Watch. Perfect. Okay, now one question that a lot of people and myself are curious about let's suppose that we find out that our biological age is older than the theoretical number. So we're aging faster, for example. So what are the criteria to understand how reversible are situations like this, and when are they reversible, and to what degree are they reversible when we find that we're aging faster than we should?
I mean, those amazing questions. I wish I had answers to those, but I think we're a bit too early at this stage right now.
Good.
Yes,
This is also good. We also want to understand if we are, how early are we, and what do you see towards the future? Yeah.
Right. Yeah. I mean, we can right now at least kind of interpret two scenarios when you are predicted older or you predicted younger. With those, we know that you can change those, but it's a bit tricky to tell whether it's, let's say, too late and there are some pathological or reversible changes, and etc. Of course, if you already have some age-related comorbidities, some diseases, it means that you already kind of have some pathological changes, and those are really hard to reverse. Yeah. But people are still working in some of the therapeutic areas to reverse those. People are working even on fibrosis right now. And we thought before that scar tissues, they're just not removable. And let's say if you have scars on your liver or your lungs, that they will be with you until the end. But no, it's not the case. There are right now drugs that can actually, solve those. I mean, of course, there is nothing approved yet, but at least they're in the process of development. So there is hope that even some pathological changes in the future can be reversed with therapy. So therefore, it's a bit, tricky to answer that question, but that's an amazing question and important to have in mind.
It is tricky, but so if we get, for example, a person that doesn't have any serious disease, okay, and maybe just the lifestyle is not very healthy, but no major serious diseases, and they find out that they are aging faster than they should, could we establish that it's quite possible that simply with lifestyle changes they may be able to revert this trend?
Yeah, for sure. It will depend on the type of a clock you use because there's so many of those. But we would expect if you, let's say, quit smoking, start exercise, change your diet, and et cetera, you can actually reverse them. There are also some supplements that can help you to do that. And right now there are drugs like Metformin. Of course, you still have to, let's say, have your physician to prescribe you those and see your results, but they're out there.
Yeah, exactly. This is something great. This connects with, there are a lot of people in very well-known podcasts, like the Joe Rogan podcast and many other podcasts. And, they talk a lot about this metformin and a lot of other, which I cannot remember right now, 3, 4, 5 different supplements and things that they really say that can help in these processes. But how can people is there an agreement about these supplements right now, or is there still controversy? Or are some of these have they reached consensus in terms of helping with these processes, or not?
Yeah, yet? That's again a really amazing question. Let's say for Metformin, I believe that most people in the community would agree that it should extend healthy lifespan. Yeah. Yet it also has side effects as any other drug, and Metformin is actual drug that has to be prescribed to you by doctor. It can negatively affect your muscle mass and etc. And for Metformin, coming back to your question, we cannot actually, let's say, claim anything unless we actually have conducted clinical trials and show that those drugs extended human lifespan, right?
And that has not been done. That has not been done, of course. Yeah.
So, TAME is something that is kind of in a process right now. We're actually waiting for results to appear, hopefully this or next year. It's kind of, I think it's finished already. So they're kind of preparing the results, and it will be a big deal. But there are also other drugs that are right now under exploration and also in clinical trials. So there's rapamycin, and that's another drug. It's mTOR inhibitor, and mTOR is one of those really important pathways. So some combination of molecular mechanisms in our body, important for aging. And rapamycin believed to work because previously, actually, one of the large pharmas, Novartis, they work with Rapalox. It's like a family of those drugs that inhibit mTOR and rapamycin and one of those. And they showed previously, they did a really interesting study because, pharma work in aging space is a bit tricky. Aging is not an indication that FDA will, take easily for drugs to be run clinical trials against.
Yeah.
So what Novartis did, they kind of carried out a study with the vaccines in elderly patients. And we know that with age, elderly patients, they tend to respond better. They have less immune cells. Their immune system is not that active and
That's
so on.
strong.
So they tend to respond worse to flu shots. So what Novartis did, they put one group on rapamycin. I think it wasn't rapamycin, it was another rapaloc, but that's not important. So let's say a close friend of rapamycin as a drug. And they showed that people on rapamycin, they tend to respond better to flu shots. So they kind of boosted their immune system. And so right now, the lady who did this study, she's kind of in a separate company. She started her own company. They're working not on the same drug that Novartis explored, because of patents issue and so on. The pharma is really complicated in that way. But then another one, and they're kind of running clinical trials on those. We'll see how it goes. Because they're not working on the same drug, there are some issues with efficacy, so people are a bit skeptical about that. But we hope it will work. Another group of compounds interesting to follow is Senolytics. They're, let's say, quite new, quite recent. And those drugs that kind of kill senescent cells. Right. So kind of we're clearing them out of our body, and therefore we're trying to slow aging process. And Senolytics right now are in clinical trials. So there's a company called Unity. They're like a unicorn company out of Bay Area, and they are right now kind of in clinical trials with those Senolytics, not against aging, but against age-related pathologies. Okay. So against arthritis and also macular degeneration. So which is known to be like age-associated. Important. Yeah. So there are drugs or in different stages. Some will believe they will work. And I think it's a time for us to be rather optimistic, because again, we have aging clocks. Now we can actually go out there and run clinical trials, and we as a company will participate in those clinical trials. So we are aiming, to contribute to the industry. So it's about time we actually will have a therapy that will work. Having said that, I have to warn you that both Unity and Restore Bio, they kind of failed their recent clinical trials. Again, for multiple reasons. That was let's say, step back for the industry. But it doesn't mean that we have to think that it's not possible. No, we still believe it's possible. Clinical trials, in pharma, they have around 86% failure rate.
Wow, 86%.
Again, for multiple reasons. So the process is really complicated, but we are getting there, and we will have our drugs. Right? We will have our interventions.
This was a really, really good summary that you did. I mean, really, really interesting. And I have to ask you, because I'm looking at the apples that are on your right, and this connects. I wasn't going to ask you about this, but it just came to my mind. That is the issue, the topic of intermittent fasting. I am right now myself doing intermittent fasting. I last ate 16 hours ago, I think. This intermittent fasting thing, I don't do it all the time. I just do it. I actually don't do it on purpose. This is the funny thing. When I was a little boy, I never had breakfast because I never felt I needed breakfast. And everybody would tell me, you need to have breakfast. It's very, very important. It's the most important meal of the day. So I started having breakfast. And after many, many, many years, I start to hear about this intermittent fasting, like, oh, you let the body rest. And I say and they say, just have your dinner, then you don't have breakfast, blah, blah, blah. And I said, that's what I always like doing naturally. So now from time to time, I just do it again because it doesn't require any effort to me. I just don't feel hungry at breakfast. So I've been now 15, 16 hours not eating, and I don't feel hungry at all. Now, my question to you is, this is a topic that is very much in fashion now, very trendy. What is your personal opinion about intermittent fasting? Do you think that it can help? There are all these videos that tell you, after 18 hours, this starts to happen in the body. Then the ketones and all this stuff, blah, blah. What is your opinion about this intermittent fasting? Not about the radical fasting, but more like intermittent. Yeah.
Right. Yeah. So, there is a huge basis behind that. So we know that calorie restriction as an intervention works in animals. So we yet to show the efficacy in humans, but it is believed to work. Yet I have to say that we as a company kind of working with clinics right now. So we sometimes have to analyze some of the particular cases when we're predicting biological age to clients of those clinics, patients. And we see that it's not always the case when the fasting is actually working. And the reason for that is usually that people are, let's say, fasting not in the right way. Yeah, they tend to keep their let's say dinners and not having breakfast, something like that. Or maybe, I saw even extreme cases, a person was only like having a dinner and that's it. Again, that's too radical.
They actually, they say that the CEO of Twitter does that. I think that Jack Dorsey, I think they say he only has dinner or something like that.
Right.
Yeah.
It would be interesting to see his blood and his biological age. But again, it's rather extreme.
Yeah.
Plus, especially if you do this for a long time, and it's also still, you need, let's say, not to eat like steaks before going to bed and consider this to be your right diet. You just, you eat the steak and that's the whole, like the whole food you ate during the day and that's it. So it's probably not going to work very, very well for you. So let's say, I would always suggest find the right physician who know about aging clocks, who know about longevity, and then ask a physician to guide you in that direction. Because usually you need to, do some blood testing to see what's going on initially with your body. Yeah. And then you can adjust from it. Maybe you're liking some vitamins, and if you go on fasting, you're kind of not going to get them from food, essentially. So you probably need to get some supplementations along the way, and etc., etc.
Yeah, that totally makes sense. Definitely for longer fasting, people should take the advice of physicians. Yeah, it would be risky. Very good. And you're speaking a lot about aging clocks, and we understand now what an aging clock is. But what are some examples of aging clocks?
Yeah, there are plenty of those. Yeah. The whole industry started in 2013 when Professor Steve Horvath out of UCL, he published a first, let's say, predictor of age, epigenetic clock for humans, where he showed that you can predict age of individuals using their DNA methylation. So it's something, let's say, on our DNA, on our genetic material, some modifications there that kind of regulates how it works.
The methylation, so, yes.
Yeah, so like there is let's say, next level of complexity compared to your like genome and how your genes work, and et cetera, et cetera. And those patterns on your DNA, so some certain signals that your cell know how to process, they kind of change. They change with aging. So they usually tend to kind of lose methylation in cells. That has been connected to activation of, let's say, some of the wrong elements in our genome, some like garbage elements that can be a bit damaging. And that's one of the, like, let's say, theories of aging, that we kind of have this genetic instability because we kind of tend to lose methylation. But also with methylation, you can predict biological age. So that was like, let's say, first type of clocks used or built for humans. Now it's shown that, yes, it's associated with mortality. It's for smokers, there are certain changes, etc. Yet epigenetic profiles are a bit hard to change. And therefore, it's a bit tricky for a person, to measure the epigenetic age and then got, let's say, on a diet, on a therapy, and then expect the epigenetic age got younger.
Okay.
So it should eventually change, but it's probably not going to happen within a year. I mean, depending on the type of intervention.
So it's a slow change. It's a slow change.
Yeah, it's slow. It's more like a, let's say, global trend, unless you actually directly interfere with epigenetics. Because you can do that.
You can.
Yeah, you can do that. There are drugs there, and they are actually those drugs that are believed to be really promising for aging process. But I would be really cautious about those because, again, that's let's say some global regulator we have in our cells, and if you interfere with global regulators, you should expect a lot of changes.
Yeah.
And it doesn't mean that those changes should be positive. You can have a lot of side effects and a bit harder to control those. So it's not going to be that really specific, the therapy, and can have a lot of side effects. But yeah, we prefer in the company work with a different data type. We also work with the epigenetic profiles, but again, to see those long-term changes, some trends, global trends, but we prefer to work with blood biochemistry because it's also something more responsive to a diet, to certain interventions or lifestyle changes, and therefore it also cheaper to track, cheaper to measure. Epigenetics. I mean, if you want to measure your DNA methylation, it can cost you like several $100 or up to 1,000, maybe depends what you will measure. But with blood biochemistry, those are really simple and standard tests you can get. So, and again, those are cheaper, at least cheaper compared to epigenetic profiles.
Very good, very good. With a blood test, you analyze the blood biochemistry, and you can get some indicators, good indicators there that react faster also.
Yeah.
Very good, very good. Now I can't wait to go into the artificial intelligence area. I actually do myself a lot of work in deep learning, and I have followed your work with Insilico Medicine, combining GANs and reinforcement learning for inventing new molecules and then constraining them. And I mean, absolutely fascinating, amazing work. So now regarding your current work with deep longevity, how are you guys applying deep learning, machine learning, AI in combination with these aging clocks?
Great. So we actually use deep neural networks as models to build aging clocks. So that's like a model that receives some profile of a person, let's say their blood values in their recent blood tests, and return biological age as output. So yeah, we work with that, and I can tell that I mean, shallow machine learning, so standard machine learning like linear regression, random forest, is still used to design aging clocks. But I would tell that the diversity of aging clocks designed with deep neural networks is just bigger. We have more of those clocks designed with deep neural networks, and that's mainly because some of those are actually like imaging-based clocks, and you can't really work with images without neural networks right now.
Exactly.
It became like a standard operating procedure.
That's very interesting. So you guys are like training like CNNs and things like that with images of a specific whatever for the neural network to predict the aging, the age. Wow. That's interesting. So you are mainly using them for I mean in a predictive way, classification, prediction, right? Also in terms of recommendation, I mean, are you using like deep learning to also like generate recommendations?
Yeah, we do that. We generate recommendations. We generate also, let's say, some aging trajectories, especially when we work with gene expression data. So we don't use GANs as architecture. It's really unstable, hard to train.
Yes. Yeah.
We use different variations of those.
In Insilico, in your work with Insilico Medicine, you guys used GANs quite successfully, right? I mean, they work pretty well for you.
They're also not. I mean, they're also not GANs as architecture. Those are usually autoencoders.
Autoencoders. You're right. You're
yeah,
right,
when you have one network.
You used autoencoders. Now I remember this video that I watched. Yeah, it was autoencoders. You're right.
Yeah.
Okay.
But I'm probably not the best person right now to talk about the Insilico research because, again, I'm with Deep Longevity now, and they probably kind of changed their architecture so many times. So.
That's true. But anyway, in Deep Longevity, you guys are not using GANs anyway, but you're using mainly these sort of networks you were talking about. And so do you see the role of deep learning and AI in your work and in Deep Longevity and in this general area becoming, more and more important and strong with time?
Yeah, for sure. And we believe in deep learning. So we believe that this is the right way to design aging clocks because of the superior accuracy, because biological data is so heterogeneous, it's so hard to get some trends there. So you actually need neural networks with their ability to capture highly nonlinear trends there. And again, there are also types of data where you cannot work with it without having a deep neural network as a model, as an architecture that you use. And for sure. So, but there are only a few companies who do that right now. Actually, we're probably like the only company who claim to do aging clocks with those with deep neural networks for now. But there are others who publish the research. So they're not companies, but they're like research groups, and et cetera. So we're not the only one in the space, but at least we're the only one who tried to commercialize that. And there are multiple reasons for that. It's hard to train them. It's expensive. We spend a lot of time actually on GPUs. A lot of money and time in training them. All of that, and hard to find people who are trained to do that.
Yeah, I know.
So engineers, it was a problem at Insilico. It's the same problem we have here. Really? But at least we kind of covered now from the talent perspective. But still, but it's hard to compete with Google or Facebook, for example, for talents.
Right. They have all the money and they have all the reach to get all the top talent.
Yeah. And some engineers, they just prefer to work at Facebook when they have their own free chocolate bars, etc.
They have that city. I was in the Facebook city, in Silicon Valley, that little city they have. Yeah, but then the companies like yours have a lot of advantages as well because you can be more agile and you have a lot of advantages in relation to those big giants.
Yeah, for sure. One of the advantages, and this is I'm constantly getting this, and this is the main reason why I work for the company I work right now for, is that you kind of. You kind of contributing to society in a way. You work in such an amazing field, and you have an ability to impact there. So you're just not another one engineer who is kind of analyzing some clicks on ads or projecting something that is not really interesting, or like build another like retail system or another Uber and etc. All those things that are important, but still. It's not going to impact society as much compared to, let's say, aging research.
Yeah, in my opinion, the work that for example, Aubrey de Grey or you are doing is one of the most important in the planet because in a number of years or decades, we don't know, there will arrive a time in which, as Aubrey says, aging will be seen as just this thing that you just. Fix, this thing that you just fix and that's it. And people will look back and they will look at these times and our present moment as that transition in which, people like you and like Aubrey and other people make that possible. They are, you guys are building the bridge towards a new reality in which aging. It's really interesting to think that in the past, as I spoke with Aubrey about this, in the past, aging. Nobody even conceived or even thought of doing anything about aging because it wasn't even remotely possible. So that the concept didn't even enter our minds. Now it began to enter our minds because we see it's actually possible, and there will arrive a day in which people will even wonder, how is it possible that people were just accepting that this was the way, the natural way, right? I mean, this was the way. So it's very interesting where we are right now in that transition.
Yeah, but I mean, humanity were searching for this fountain of youth for so long time.
True.
You know, all the legends, like
True.
fairy tales, everything's out there. And there were, certain extremes, people, but like, let's say, taking bath with blood or whatever, thinking that they're going to rejuvenate them, right?
Yes. That's true.
But then, people tend to accept because if you think that you can actually change that, it's psychologically easier for you to accept.
Yeah, that's interesting. Yeah. You're right. I mean, in the past there would be all these like crazy things that people were doing, but I think most of the population, I mean, they would realize quickly, okay, this is crazy stuff. So
right.
So although some would, of course, believe in it, but I think now for the first time, people look at serious scientists like you and Aubrey, and they say, oh wow, look at this. This is really this is a rigor here, scientific rigor. There is, and then people start to open their eyes and say like, wow, this may actually be possible. So yeah, it's very, very exciting. Now, connecting with the scientific side, and already moving towards the end of the conversation, I'm very curious about, you guys have a number of patents, and my scientific curiosity makes me wonder about the meaning of, you speak about this transcriptomic and proteomic aging clocks. What is the meaning of this transcriptomic term and proteomic term?
Right. Yeah. So as I said, our genetic material has different levels of manifestation in our body. So we have our DNA, our genetic code, that kind of it codes how our proteins will look like, how our cells will look like, tissues, body, etc. But before, let's say, genetic code is kind of synthesized in form of proteins that will actually work in our body and do a lot of things, regulate things, produce energy and so on and so forth. They actually there is a stage, like intermediate stage, which called RNA. So it's
RNA.
Yeah, something that kind of transcribed from your genetic code and this intermediate stage, and then later to be used as a matrix, as information how to synthesize the protein, right?
Mm-hmm.
It just has to be done this way. It's only possible to do this biology this way. You have to have this intermediate step to synthesize your proteins, right? And you kind of can then sequence the net totality of those RNAs. You can measure the levels, for example, for certain genes. And then you kind of measuring their effectiveness in producing proteins in the end. I mean, not only proteins. It doesn't mean that the protein is always the end product.
So what do you measure exactly? You measure the level of the RNA or the level of what?
Yeah.
Of the RNA?
You measure the level of RNA, yeah.
Oh, and that tells you how efficient is the conversion from DNA to the protein?
It's not always like that, but it's for some of the protein, some of the genes there, it's like that. But I mean, there are also genes that actually don't produce proteins, and they actually have those RNA. They produce those RNAs, and those RNAs actually act in themselves as sort of regulatory mechanisms, and etc., etc. So the whole system is rather complex. But if we focus only on those that produce proteins, so it's you measure how active the gene is actually producing proteins. Yet it's not like there is like a linear translation that you have a lot of RNA. You should assume that you will have a lot of proteins. Mm-hmm. It's a bit more complex than that.
Okay. Yeah.
So again, the relationship is not
never
linear.
So simple. Never so simple.
Again, never simple. But it's really it's fascinating. It's such an interesting process how our body can regulate things in so many ways, right?
I know.
So because proteins are also, they kind of undergo a lot of stages before they become like mature, the one who can actually function, right?
Yeah.
So synthesizing them, it's not enough. You you need to fold them so they have a proper structure,
Yes.
so they can interact with other molecules. You need to transport them to right parts of your cells or extracellular components, etc., etc. So a lot of things you have to do before they actually become mature and actually can, work. But they also age. You have to reduce them, either recycle them, so kind of repair them, recycle them, so they can work again, or you can get rid of them. So yeah, you can at least measure this totality of RNAs to get a lot of information.
Wow.
From what is happening on the molecular level. And then you can measure the next level, which is a proteome, right? Not totality of all proteins in the cell or in the tissue.
Wow.
And that's like a next level you can measure. And again, they're predictive of age.
Mm-hmm.
And they are really important to analyze if you want to analyze what is happening with aging on the molecular level.
This is fascinating. And you guys analyze this like from a blood sample?
Yeah.
You get the cells?
Yeah, we analyze this from blood samples, but also from skeletal muscle, from skin. I mean, we're trying to work with the
any cells
accessible, and I mean, yeah, you in principle you can work with any cells you can extract, but then it's not going to be that easy to translate into practical application, right? It's easier to collect blood from patients than to collect other tissue types. But I mean, skin is also rather easy to obtain. Skeletal muscle is also like a small punch biopsy, and you kind of get your sample, and that's it. But for the rest of tissues, it will be rather tricky to get.
Very interesting. So going beyond, that is the title of this podcast. So do you think that in the future, people at their homes will be able to have a device that they prick it and analyzes this proteomic and all this stuff and gives them an estimation of aging?
Well, actually, it's already it happened. So we have this device.
Really, you have this device?
Yeah. So there is a company. I mean, usually sequencing machines, they are really big.
Yes,
they're
exactly.
Just incredibly big.
Yeah, I knew this.
But they're getting smaller and so on and so forth. So there is a lot of things going on out there for us, to process things efficiently, get the results quickly. Yeah. But there is a company called Oxford Nanopore. They have this small device, which is like a size of a USB flash drive. I mean, it's a bit bigger. USB flash drives right now are smaller, but let's say it's smaller than my phone, right?
Yes.
It's something that you can actually plug in. I mean, you can put your sample and then plug into your computer, and it will actually get reads, right? Yeah.
Wow, that's amazing. Is that commercialized already?
Yes, they are working. They're working right now. I believe COVID for them should be like a really amazing opportunity, because previously they were focused on infectious diseases. So the whole concept is actually that you will have this at-home kit, right? Mm-hmm. And then you can test whether you actually have influenza or it's something else, et cetera, for example, if you got sick. So the applications there are just amazing. You can send this to Africa, for example, to test for infectious diseases. And of course, in the future, then you can, run other diagnostic tests with such a technology.
That's amazing. And if you get that device today and you connect it to the computer, is there already software that can actually analyze the aging through it already? Not yet the aging. Okay. So the device exists, but not just the software that.
Yeah, because they also sequence your DNA. Mm-hmm. So they don't sequence RNA, and with RNA, it will be tricky in principle to sequence this one, because DNA is more stable as a molecule. It's easier to extract from samples, right? When you let's say you have your blood sample and you can kind of get your DNA as molecules from there, so you can later, analyze the sequence, analyze what's going on there. But with RNA, it's trickier. It's less stable. It's even less stable because on our, let's say, hands, we have a lot of mechanisms how to protect against RNA. And on our hands, we have, let's say, certain protections against RNA. And that's why when people work with RNA, they have to have especially clean rooms.
On our hands, we have protection against RNA. Why? Why do we have this in an evolutionary?
Because most of the viruses, they carry their genetic information in form of RNA instead of DNA.
That is fascinating. That is fascinating, ladies and gentlemen. That's fascinating. Well, that's amazing. Wow. Okay, you have to give me later the name of this company that makes this device. I'll put it on the description of the video for people. It's super interesting. But anyway, but you see that towards the future, people like you and others, it will probably, if this already exists, eventually there will be one that also analyzes RNA and gives you the aging clock stuff for sure. Yeah, if we're already in this point, in a matter of years, the other one will be real, right? Yeah.
Yeah, for sure. I mean, the future looks bright. So we have so many technologies right now. Yeah, it's a possibility to have such a at-home kit. Yeah.
So to complete this fascinating conversation, just to end with it, could you tell us, for you personally, what is the most exciting? Looking forwards, what excites you the most about your work, about the future, about life, about everything?
Right. I mean, again, I'm really biased right now, but aging clocks in general, because then those tools that we can actually use to find therapies, to find therapies that will work as longevity therapies. Also evaluate our lifestyles, see what works for us. Let's say move it in a more like a personalized way. What works for us. And then we can run clinical trials finally with new drugs and, make all those claims reality, because there are a lot of companies out there who claim that they have certain products and maybe they work. We just don't know yet. But with aging clocks, we can actually, prove the efficacy or prove that they don't work. But let's hope that they work and we prove the efficacy. And we can actually, put in the end the number next to it. So for in the end, we want to know exactly how it works. And let's say that, if you take this pill, you will get younger by this amount of years, like, let's say, ultimately. But that's something we can try to reach.
Wonderful. Well, with this very, very positive and very bright note towards the future, we can conclude this wonderful conversation. I think the audience and myself, we get a lot of this. All the stuff that you have told us. So thank you so much, Polina. We will be following your work, which is so exciting, and we look forward to all the progress in the coming years. Yes?
Thank you.
Thank you, Polina. Thank you. Thank you for following the Beyond podcast. If you enjoy it, subscribe on YouTube and support it in other channels like Patreon and others. And hope to see you soon at the Beyond podcast. Thank you.